everyone. Welcome to Living Well, the Ultimate Health Journey. My name is Alice. I am your host. We also have with us Dr. Philip Zini, Coach Angel Marie, and then we're missing. We also have Giovanna or Jovi Marie as well. Welcome, everyone. How's everyone night going so far? Hello. Hello.
Fantabulous.
Fabulous.
Great. All right, so tonight we will be talking. Dr. Phillip is going to give us a great lesson. And what do we say we're talking about, Dr. Phillip Zini?
CBDA.
CBDA. Everybody loves CBDA. I know I do. So, so we're going to learn a lot about CBDA tonight. And if you have questions, as usual, on TikTok, Facebook, Instagram, go ahead and put your questions into the chat and we will try to get them answered as we go along with the 30-minute show. All right. We do go over a little bit depending on how many questions you guys have for us. But we're going to go ahead and get started because they don't have much to say today. They're tired. They probably want to hurry up and get the show done and go home. All right. So, Dr. Phillip, what we got going?
So a little bit of a brief background. Back in 2017, the FDA made it onerous for physicians to prescribe narcotics because of the opioid crisis. And because of that, I searched for an alternative for pain relief, and I found CBD. And then as I went further and explored more, there is a better product called CBDA. The A stands for acidic, and that just means it's the parent. It's what you find naturally in the plant. The reason why you don't see it often out there on the market is because it's extremely hard to stabilize it and to keep it from breaking down in a bottle. So there is a proprietary way to stabilize it to make sure that the same potency that you have when you first open the bottle and it's delivered to you, that you have it months later. And that's what we found through our product and the 10X Pure delivery system. So then you may be asking yourself, why is A better? The big reason is there's a research, unfortunately, he recently passed. His name is Dr. Raphael McCollum from Tel Aviv University. He found out that the acidic, the parent form, is 1,000 times more potent than traditional CBD that you would get at your head shop or dispensary or whatever you want to call it. And as a result, that's the one that we want to concentrate on because of the potency, because of the fact that you have to take less in order to get a good effect, and because it's been proven over, like I said, since 2017, all these years in studies to be good for not only pain relief, but also for autoimmune issues or for general inflammatory issues, not just for muscles and joints, but for other inflammatory issues in the body. So with that little bit of kind of an introduction, I'll take a pause for specific questions or something that may have been jarred in some of the studio audiences.
So I actually have a question for Dr. Zini, and that is, so I work with the elderly, and one of my clients used some CBD oil, rubbing it on his back, and he claimed it did wonders.
Mm-hmm.
And so when I was pregnant, I developed sacroiliac joint pain, and it is horrendous. One of the most, like outside of labor, like that pain is up there. So is this a product that will work on my back with that pain?
Yes, it will. The only caveat is there's not a lot of research about pregnancy. So we don't know how CBD or CBDA would affect a developing fetus. However, now that you're postpartum, and I'm assuming you're not breastfeeding,
Nope.
it will be okay to use it, and it will be wonderful because the SI joint, the sacroiliac joint, is kind of superficial. It's kind of close to the skin. So by rubbing the cream on, that should help out. And if there are some other underlying or deep type of issues, then hitting it from both sides, so using the cream on the skin and dropping the oil underneath your tongue to be absorbed,
Oh.
will be a way to get both sides at the same time. But I've seen it work miracles not only in my patients, but I even had a fibula fracture, and it healed in 2 weeks as opposed to typically 6 weeks. So it
Wow.
it works wonders.
Thank you so much. I'm getting some of that ASAP because I still have those twinges. And it's like, oh, can I get some relief? And normally what I did was physical therapy and some stretches. That definitely helped and wear my back brace. But it's not enough though. So
Yeah, and one of the reasons why it works out so well is that there are little receptors for CBDA in the joints, in the ligaments. So it actually helps to counteract that pain by acting on that same receptor that some pharmaceutical agents work on, but it does it naturally through the endocannabinoid system. So it's a wonderful drug, and it's been around for millennia, for thousands of years.
awesome. Thank you so much.
Yeah, that is awesome. I have a question. So, do CBDA work on? I know they have the cream at CTFO. And if anybody interested in any of the products that Dr. Phillip is talking about, Dr. Zini is talking about, you can go to mywellbeing.myctfo.com. Oh, look at that. I got the correct tonight. I didn't stumble. Okay. Yeah. But they have the cream. So do the cream have the CBDA in it as well?
It does. So if you know you're going to be using it, it comes in a jar, or if you want to have something to travel with, and you're going to be using it long term, you can get it in the little packets. It just depends on how or where you want to use it.
Okay.
So the short answer
Now,
is yes.
Yes. So most people, I know we're not supposed to, but are there any cons using CBDA?
So the only thing I tell my federal employees, so that would be truck drivers, airline pilots, military, civil servants, is that because there's a trace amount of THC in there, not enough to get you high, nowhere enough to get you high, but there's a trace amount, and that's because it's what we consider a full spectrum product. Because of that, it may trigger a positive test. So, depending on what type of job you're working in, you may not want to take it if you're at risk of triggering a positive drug test. Other than that, no.
I see. But what, and I guess, yeah, it's not going to make you high. So, the happy people you won't get that happy. Is that what we're saying, Dr. Zini?
Right.
No. Okay.
Right. Yeah.
So it's a trace in there. But even if you have a trace in there, you can actually get something from the doctor saying that it's used for medical purposes only, right?
So it might work out, but I wouldn't jeopardize any job for that. Sorry.
All right, well, there's no need to be sorry, Dr. Phillip. I think we're okay. They will be okay. They should know not to do that. Once again, welcome to the Living Well Health Journey, the Ultimate Health Journey with Dr. Phillip Zini, coaches Jovi Marie and Angel Conway, and myself, the host Alice Boswell. So we're talking talking about CBDA today. So we're on TikTok, Facebook, and we're on YouTube actually. All right. So any one of the platforms, please like the platform. Make sure you follow each of the hosts so we can get a great following and get a great thing going. What else do we have to add, Dr. Philip Zini?
So some of the other concerns that people have about any type of product is it natural? So the CBD A is grown here in the United States. It's organic, so it's going to be pure, and it's not going to have any herbicides or pesticides or any abnormal green any type of substances in it. And when you go to the website, you can actually pull up the certificate of analysis to show that it is a pure product. And then, like I said on the top of the program, that it's 1,000 times more potent than CBD that you would get anywhere else. And the other thing I said, that not only is it good for musculoskeletal pain, but it's also good for immune issues or autoimmune type of related issues and neuropathic pain. So Jovi has a wonderful diabetic group that she mentors, and we've seen people that have used it both orally and topically, and it's helped reduce with their neuropathic pain. And that's the kind of burning type of pins and needles. Sometimes people say it feels like they're walking on glass type of pain that they'll get with diabetes. So it'll help out with that type of pain additionally. So it's a great overall pain product. And then probably the most exciting thing is there was a study that came out about 3 months ago now, and it was written in a dental journal. And dentists are starting to use it now for acute dental pain. So sometimes people can't tolerate or they don't want to take narcotics. So it has the pain killing effect as a narcotic. And this was proven in a study by dentists. And I don't know about you, but most people don't like going to a dentist. I love my dentist; he does a great job with pain relief. But for people that are a little bit hesitant, uh, it's a great way to prove that it does help out with pain relief.
All right. I have a question for you, Dr. Phil. Let me
Go ahead.
bring myself up so I can. Well, I want to be seen too. Give me a chance, Dr. Philip. I want to be seen. I want to ask my question. Okay. Hey, buddy. I'm Alice. How are you? All right. The question is, are there any potential interactions between CBDA and other medications or supplements that I should be aware of?
So there aren't many. The only one is a real old blood thinner called warfarin or Coumadin. Other than that, there aren't any real issues that I've seen in my patients. If you have any big concerns, just check it out with your primary care provider. But the big one I've seen was Coumadin or warfarin, which is the type of blood thinner. Other than that, I haven't really seen anything that should be of a concern. Because again, it's helping to balance the endocannabinoid system, the immune system. It's been around for thousands of years. So there really shouldn't be any issue with it.
I also have another question for you. I don't know if this is, I don't know. Can CBDA go into diet shakes?
Go into what?
Shakes.
Diet
Diet shakes. So,
You can. The only issue is absorption. So the best way to get it absorbed into your body is through the lymphatic system, which means that you drop underneath your tongue. When you ingest it orally, like you eat it, the absorption depends on what's in your stomach at the time. So that's why oil dropping underneath your tongue is the best way to do it. It's peppermint flavored. Most people like peppermint. I've been using it now for 5 years. Haven't had any problems with the taste or anything like that. So should be okay.
How do you know you have a good dropper or taste or a good batch of CBDA? Because so many
So that's
companies.
where, yeah, so that's where the certificate of analysis comes in, where the GMP, which means good manufacturing products, comes in, and
Mhm.
just the company. The company I've been working with has been around for 6 years. I've followed their GMP processes for 6 years, and I trust them. I know the owners, so yeah.
Okay. All right. So we learned
So,
about the topical products that we can use. Go ahead.
so Dr. Philip, I know that a couple of the members in our group were,
Mhm.
can you explain to the people in reference to the diabetes and how it actually helped lower the A1C when they were consuming that, and
Yeah,
also they felt a difference in their joints as well?
yeah.
Mhm.
So again, most type 2 diabetics, it's really an autoimmune or a underlying inflammatory issue. So because of that underlying inflammatory issue, that's what cannabinoids or CBDA specifically does. It helps to modulate the endocannabinoid system, which is affecting the immune system, and that all helps to reduce inflammation, reduce the irritation in the body. By reducing that, now you're going to indirectly affect the insulin resistance. And by indirectly affecting the insulin resistance, that's how blood sugar is reduced, the A1C is reduced. However, as far as the nerve inflammation, that's a direct effect from the CBDA. So there's a couple of different ways that affects individuals. Indirectly is through the inflammatory response, directly the inflammatory response working on the nerves and the joints, because again, you have these CBD receptors within the joint. So that's why it helps out the most there.
Very good. Very good. I have another question for you, Dr. Philip.
Go ahead.
Are there, this is from my girlfriend Party Rentals off of Instagram. Are there any CBD products that can boost our immune system?
So technically, that's what CBDA does by
Mhm.
modulating the endocannabinoid system, which means kind of regulating it or stabilizing it. By doing that, that directly affects the immune system and allows the immune system to work more beneficially, more balanced. So it helps with autoimmune issues by kind of tamping down the overactive immune process. And that's usually what an autoimmune response is, where the immune system is kind of in overdrive working against the body. So by tamping that down, by kind of tempering it, it helps out tremendously.
Okay. All right. And once again, we are here with Dr. Philip Zini, and tonight is our weekly health talk on living well, the ultimate health journey. If you have any questions for us, go ahead and, well, not for us because we're not doctors, but we do have a doctor on staff that's going to give you all the answers that he could, if it's feasible. Please remember to do seek your own professional help. Dr. Zini, he's going to try to help you, but he don't want to give you wrong information either. And but my doctor said, we understand what your doctor said, but Dr. Zini is a doctor too. All right, what else we got going on? All right. All right, what else we have, Dr. Zini, about CBDA?
I think that pretty much wraps it up. The big issue about delivery is to make sure that what's in the bottle is being absorbed in your body. And the way that you have that is by having a delivery system that can essentially mix oil and water, because CBDA is an oil. Your body is pretty much water, except for the cell membranes, which are
Mhm.
oil. So you need something that is kind of wrapped up in a package that can get through that oil water barrier. And that's what the 10X Pure delivery system does with our CBDA product to make sure that you're getting it absorbed through the lymphatic system underneath your tongue so that this way your body can utilize it. Because it doesn't make a difference what's in the bottle. What makes a difference is what gets absorbed into the body. And this
Right.
product does that for you.
I have another question. Someone want to know what is the cost of CBDA products. Um, but I'm taking it may be factors as the formulation and doses that you get. Is that correct? Or the brand?
Um, yes, and it also depends on whether you're buying it retail or wholesale, the size of the bottle. The bigger the volume is the most cost
Yeah.
effective. That's where you get the most CBDA per bottle is when you buy the 1500.
Okay. And
And they can
someone, I
see all
guess,
that on your website.
yeah. And they want to know what is the best way to take it. You mentioned the cream. Is the cream, the drops, or the pills better to take?
So if it's a superficial issue, like a knee, a wrist, an ankle, an elbow, your low back, your
Hmm.
neck, then the cream may be the best way to get it. If it's more of an overall body issue, like maybe fibromyalgia or multiple arthritic type of joints,
Mhm.
then you may want to attack it from both ways using the oil and the cream.
Okay. Very good. I mean, we're getting some good questions here today. What you all think? Y'all think we're getting some good questions? Dr. Philip Zini, my girlfriend's party rental says, thanks, Doc, very much.
You're
Everybody
very
saying thank
welcome.
you.
It's a pleasure to serve.
It's a pleasure to serve. All right. Y'all know I'm not playing with you. They said since you're a doctor, is it better to get it from the doctor so you can get a prescription so the insurance can cover it, or should you just go ahead and buy it? That's a great question.
Yeah,
Mhm.
to be honest with you, I don't think insurance covers any um,
Oh,
marijuana, THC, CBD products. Um, Even if you have a medical card, I don't think insurance covers it. I've never seen it. Um, so I mean, we guarantee the potency of our product. We have a 60-day empty bottle money back policy. So there's really no risk in trying our product.
okay. And then if you want to try the products that Dr. Philip Zini is talking about, go to Wellbeing. Well, I'm sorry. I knew I was going to mess it up some type of way. I'm just doing too well. Too well. All right, but go to wellbeingpath.myctfo.com, which you should see right down here at the bottom as it's scrolling past, and you'll be able to pick up the product there. I know the cream works. My aunt swears by the cream. She likes the cream. I have not tried the oil, but some of Jovi's um, clients in her group on Friday, they have tried it and they do like it. Is that right, Jovi?
Absolutely. They all like it. I know I have this one gentleman that he has like pain in his knees and he can actually walk now and he says that it doesn't hurt anymore. So he does have
Wow.
um the potent a little bit more higher, which is the 1500. So that's the one that he's using and that's the one that like he swears by it. He's like, I need that. I had another gentleman that has anxiety that's helped him with anxiety as well. And explain that one a little bit more in detail, Dr. Phillip, how it helps with the anxiety.
Yeah. So CBDA and also CBGA have
Mm.
been used for anxiety, depression, PTSD. There are similar mechanisms on the brain the CBGA seems to work a little bit better for anxiety type of issues, whereas they both can help out with anxiety, depression, and PTSD. It seems like CBDA may work a little bit better for PTSD. CBGA may work a little bit better for anxiety, but they both work. Again, it's in this endocannabinoid system, and the G aspect works a little bit more better than English on the brain, and the CBD can also work in the brain, uh, but it's that blood-brain barrier that the cannabinoid system seems to modulate the best.
Okay. Oh, I got another question for you, Dr. Zini. Um, oh, I would I see you, my I will definitely give you that link. I'm gonna put it in Instagram in just a minute. Ask this question for Dr. Philip Zini. I have problem with nausea and vomiting sometimes. Is CBDA shown to help with this?
So great question, and that's actually where some of the first studies were done, because people that didn't want to get high taking marijuana, which has THC and CBD. So then they tried just CBD only, and they found out that it works wonderfully for nausea and vomiting, whether it's post chemo or chemo related. And again, because the A is 1,000 times more potent than the CBD, then theoretically you should use less. And again, people that are nauseous, they don't want to swallow anything.
Mm-hmm.
So just by dropping it underneath the tongue and then getting absorbed into the lymphatic system, it should work wonderfully for them.
Okay, well, thank you very much. I hope that helped you with the question, Doctor. Y'all doing wonderful tonight. So go ahead and give us more questions as we get ready. We went over inflammation. I know he spoke about it earlier, but someone is asking about inflammation, and that would be the CBD cream from the CTFO products. Is that right, Dr. Zini?
Yeah. So again, if it's kind of joint musculoskeletal inflammation and it's a superficial or kind of close to the skin area, the cream may work better. If it's a general overall inflammation issue like fibromyalgia or arthritis, then attacking it from both angles may work better, the oil and the cream.
I got one more, and then we're gonna start winding it down, and we'll close up. But I think I have another one, maybe a couple more if you all are ready. Someone is asking from YouTube. I have a skin condition. Does it have any dermatological benefits?
So because of especially the cream, because of the other adjuvants in it, like camphor and menthol, if you put it on an open wound or some type of skin irritation, it's going to burn like heck and you're going to hate me. So I would definitely not use that on a dermatological type of condition. Now, with that said, some dermatological conditions like eczema or psoriasis are thought to be autoimmune related. And if that's the case, then using the oil underneath your tongue to help modulate the endocannabinoid system and the immune system, it may be a benefit for that.
We're going to take one more questions, and this will be the last one. We'd like to thank you all for coming out tonight and asking questions. This is, I believe, this is the most questions we have had in a long while. Can I use it for my pet?
Yes, and actually, there is a specific CBD formulation for pets. We use it with our cat every day because he had this feline tooth disease where, for some reason, the body jaw kind of reacts to the teeth, and the poor guy had most of his teeth pulled out. So after that, we started using not only the CBD oil, but also xanthomist. We'll just spray that on his food, and his gums look wonderful.
Oh wow. All right, that is actually awesome. Okay, so we're gonna bring the ladies on and they're gonna give us a few of the last talk. Dr. Phillip will be last. And again, I know I call him Dr. Phillip, I call him Dr. Phil. I can only do that to you guys, the audience. We appreciate you, but he is Dr. Zini. Okay. I'm the only special one here. All right. So we're gonna start with Angel. I'm giving us some last words out, and then we're gonna go with Jovi. She can come right on in, and then Dr. Phillip Zini will go ahead and do his little thing, and then I will do mine, and we will see you next week, every Wednesday at 8 p.m. We are here from 8 p.m. to 8:30 on TikTok, Facebook, YouTube Live, and Instagram. Please bring your questions, since we definitely want to be able to help you. All right. Next week, if you come with some questions, we're going to pick a winner, and we're going to give you a free sample of a CBDA cream that Dr. Phillip was talking about. Okay. Right. Give you a little sample of it. Right. And then you're going to come back and you're going to want some more. All right. So go ahead. All right. So we have Coach Angel Conway, our self-care coach. Go ahead.
I want to say thank you so much, Dr. Zini, for this discussion. I'm definitely got my eye on that CBDA. I do have a quick question, and that is, will the oil help with the menstrual pain?
Yeah, because again, it's kind of an inflammatory. It's kind of a spasmodic or contraction type of pain. So theoretically, it should help out with that. And you can kind of time it. If you know when your usual menstrual cycle is, you can start dosing yourself before that. So this way, you're not taking it as an emergency type dose.
I love that. Thank you so much. This has been so helpful.
Yeah, you're welcome.
Well, since she brought that up, does it help with constipation?
I don't think so. Yeah, sorry.
I don't get any special healing. All right, go ahead. Angel, are you done?
Yes.
Jovi was okay. Now we have Jovi Marie. Go ahead.
Thank you, Dr. Phillip, and thank you for always helping us out, especially with our group with Reversing Type 2 Diabetes Nerds. I'm truly grateful for everything that you've been doing and helping us out. But piggybacking on what Angel was saying with the CBDA, especially with the menstrual, it's helped me out immensely. So it does help out. So I am testimonial on that, because I've had really bad cramps and a little bit of overflow and stuff, but throughout these years that I've been using it, it's been like normal now. So it has helped out a lot immensely. And I do appreciate Dr. Phillips' always recommendations on everything that he has recommended for us.
Right.
So thank you.
Thanks a lot. Yeah, very good. Well, since you can't help me out that way, does it help out with menopause? Because I don't have a cycle anymore. So, but I do have the hot flashes, and I have the crankiness and mood swings.
Yeah, it may help out, but you're probably heading more towards hormone type replacement. Sorry.
Just stop, Dr. Zini. You just want to help the two at the bottom and just forget all about me. Okay. That is totally okay. That's you helped me lose weight, so I'm gonna say that, because I still love my shake. Okay. Right. So I have lost weight from it. But that's okay. I got you. We'll talk after the show. All right. So, Dr. Phillip Zini, do you want to give us any last words?
Well, it's an honor to help you all out. My personal motto is to teach, to heal, and to serve, and it's an honor to serve you all. So, thank you for letting me help you.
Well, we really do appreciate you, and I know I give you the hardest time, but we really do appreciate it, and especially all the information that you give us. I hope you all enjoyed the show tonight. on the CBDA. I will place it back up. If you missed it, you'll be able to go back and listen to it again on YouTube. So make sure you follow us on YouTube and subscribe to our YouTube channel. We're going to get ready to get out of here. We will be back here next week at 8 o'clock Central Time. Yeah, 8 o'clock Central Time. Living Well, the Ultimate Health Journey with Dr. Philip Zini. All right, he's here every week, except when he decides he has to go to the Caribbean or something. Then we miss him. All right, and we truly miss him. We really do. Listen, find your fire, be true to who you are, and whatever you do, inspired along the way. We all four of us are here to inspire you and make you more healthier than you were last week. All right, we'll see you next week. Thanks for joining us.
Thank you.